Good morning, everyone. I'm pleased to see you all. There's a lot of brain power here, so what I'm going to talk about are just our ongoing research of three of my PhD students. Two of them are here, Hisong and Arsen. And these are ongoing works, so given the brain power in this room, please reach out to us if you have any suggestions or comments about all of these. I want to mention especially our esteemed colleague David Zilberman being here, and I was really pleased about his comment, right, about the importance of this topic, David. I think we rub off some influence with you. So I'm going to first talk about this project we have, a new project requested by the Texas Department of Agriculture, and it's really about figuring out this relationship between food insecurity and natural disasters, right? So as we all know, this CPS, I think Madeline mentioned this, FSS is a key source of the national and state level food insecurity data. But the question there is how disaggregate the availability of these data are. And this is an issue because most disasters, as we all know, are quite localized, right? So to address this gap, we constructed county-level food insecurity estimates following the map the meal gap, the MMG approach. And we're working, by the way, with Craig Gunderson on this project. And really the objective here is to enable analysis at a more localized level related to disasters. So this is the map the meal gap approach that was initiated by Craig. Feeding America publishes these annual county-level MMG datasets. Hisong's work a lot on this, and which would include food insecurity rates, cost per meal, and other indicators, right? They've, however, undergone a lot of methodological adjustments through the years, so it's hard to compare some of these estimates across the years. Consequently, we applied some methodology to estimate some food insecurity rates at the county and zip code levels. So probably similar to what Madeline mentioned. We may have to compare our methods, Madeline, at some point. And we're also using the ACS over the past decade. So why is Texas interested in this? As you can tell from here, there's been an increase in billion-dollar disasters in the United States. But Texas is particularly vulnerable given the location of the state. Texas is in the top 3 in terms of net migration as well. So it has a large population, diverse geography, frequent occurrences of natural disasters, tornadoes, hurricanes, you name it, right? So this is ongoing, as I've mentioned, and preliminary analysis indicate that in disaster-prone areas, improved food accessibility may help reduce food insecurity, okay? So that's for Hisong's project. I want to move on to Xiaohan's work. Xiaohan is not here, unfortunately, due to family reasons. And this is about figuring out the effect of SNAP benefit enhancements on food sufficiency and mental health, right, during the COVID-19. I think Park mentioned this, that during the COVID years, there was a 15% increase in the maximum SNAP benefits, right? And so we're going to focus on the impact of that basically increase in SNAP benefits, right? And focus on 3 outcome measures: the food sufficiency, anxiety, and depressive disorder. So we're using the Household Pulse Survey for this particular study, using DIDs. And overall, our preliminary result suggests that the 15% increase in benefits led to a significant improvement in food sufficiency and reduction in some of the mental health measures that we focused on during the COVID-19, but no significant impact on depression. Okay. Another topic that Xiaohan is focusing on is on the SNAP benefit cycle. I'm sure many of you are familiar with that issue, right? But we want to know if there's difference in the characterization of the SNAP benefit cycle for those with and without diet-related diseases. And why is this important? Because if you have a diet-related disease that's chronic and you have the SNAP benefit cycle issue, it could be more problematic, right, health-wise. So just briefly, the SNAP benefit cycle is about food spending spikes in the initial days after the SNAP benefit distribution, and then declines towards the end of the month, right? So at the end of the month, many of these households don't have money to buy food anymore. So it's an important issue. So we investigate basically whether food purchases vary across the SNAP benefit cycle between those with and without diet-related diseases. And we focus on obesity, hypertension, high cholesterol, and heart disease. So in terms of data, we use the Nielsen HomeScan panel and merge it with the Nielsen Elements panel. Preliminary results suggest that SNAP participants, regardless of diet-related diseases, show significant benefit cycle expenditure patterns. I was hoping not, but that's what we're finding so far anyway. So no significant difference in food spending patterns across the benefit cycle between those with and without diet-related diseases. And they remain consistent when restricted to single-person households. My third PhD student that I want to mention is Arsene here, who's at the back. So Arsene's first paper is focusing on the impact of the government shutdown in, was it January 2019, Arsene, right? It was the longest government shutdown in US history that began in December 2018 and lasted for 35 days. And to prevent SNAP recipients from missing their February benefits, USDA required all states to disburse the February benefits basically by January 20th. So if you can see from this graph here, right, this is the January 1, you see two dots in many of these states, in most of these states, right? Because by January 20, they were required to disburse basically the February benefits because of the government shutdown, right? So it's a very interesting policy, exogenous policy change, if you will. As a result, SNAP disbursements schedules were unexpectedly modified in early 2019, as I mentioned. At the federal level, February 2019 benefits were issued by January 20th, as I mentioned. Households unexpectedly received 2 months worth of benefits then in January, as you can tell in the left-hand side of that graph, right? But on top of that, several states also adjusted March and April disbursements dates to reduce the gap between the monthly payments. And so this is the March and April here. You can tell that there's been quite a bit of change as well in those states. So Arsene tried to analyze a lot of these things. So the research question is, how did the early and unexpected disbursement of SNAP benefits affected the recipient's food purchasing behavior, right? And so we want to know the impact basically of this government shutdown and early and unexpected benefits. Nielsen Q HomeScan Consumer Panel is what we used for this study. And overall, the preliminary results indicate that SNAP-eligible households were unable, unfortunately, to smooth their food expenditure from January to February, right? Households reduced per capita expenditures by about 6% in February. That's because in February, they didn't get any benefits, right? They got their February benefits in January, basically. So it's mainly driven by households in states with low SNAP participation rates, and states that issue SNAP in the first week of the calendar month. So on average, households significantly reduced the healthfulness of their food purchases in February by close to 9% for healthy food expenditures, 9% for fruits and vegetable expenditures, and the composite diet score about 5% reduction, basically. Okay, the second paper of Arsen's dissertation is about these universal free school meals, right, on households' food purchases. So during the COVID-19 pandemic, the federal government temporarily waived the requirements for CEP participation. It's community, what is CEP, Arsen? It's Community Eligibility Program, yeah. So this is important because it really led to the first nationwide implementation of the universal free school meals, right? So some states have extended the implementation of this policy after the expiration of the government waiver in June 2022. So we're exploiting that change, basically. And as the 2023-24 school year, 9 states, okay, have basically extended the UFSM implementation, okay? And once again, that's one of the variations that we're exploiting. And about 23 states have introduced legislation for such a policy over the last 3 years, while no action has been taken in some of the 15 states. So we want to know the impact of not extending the UFSM, or extending the UFSM, if you will, on households' expenditure composition, food purchase healthfulness, and food security. And they also examine whether there's heterogeneity in those treatment effects. And for this one, we're using the numerator data and the CPS FSS data. Overall, we found no significant difference in food expenditures. Arsen is still working on this, so this could change between extension and non-extension states, meaning those who extended the UFSM versus those who did not extend the universal free school meal. Though the latter spent approximately 2% more on average, there's some evidence of dynamic treatment effects over time that Arsen has found. Households who did not extend the UFSM are more likely to experience food insecurity, and a shift from 100% to 0 universal free school meal exposure is associated with an 11 percentage point increase in the likelihood of household food insecurity. The third one, and this probably relates, Joel, to some of the things that you mentioned earlier, and hopefully we can provide some answers for you in the future. We want to know basically how financial incentive with different levels of restrictions and nutritional needs could affect fruit and vegetable expenditures and food insecurity among low-income households. So this is going to be a relatively large field experiment that we're planning. A lot of logistical issues involved in this. So we want to assess the impact basically of fruits and vegetable restrictions or unrestrictions, including financial incentives basically on food and vegetable expenditures and food insecurity. So this is going to be a nationwide field experiment using an RCT, and our population of interest is the SNAP-eligible households in the US. So for those of you of interest, these are basically our treatment groups. Obviously, we're going to have a control group. We're going to randomly assign basically our subjects to these groups. Our treatment number 1 would be incentives restricted to fruits and vegetable purchases only, right? So we're going to provide basically our subjects with an incentive, an amount of money that they can then use to buy food and other things. So in T1, incentives restricted to fruits and vegetables only. In treatment number 2, incentives restricted to groceries, but SNAP-eligible food items only, right? And then treatment number 3 is similar to treatment number 2, plus a reminder on the benefits of fruits and vegetables. And then treatment number 4 is unrestricted incentives. Basically, they can buy any items they want. And we're focusing on Walmart stores for this particular study. So this one is still in the planning stage, but our center, we're hoping to start this in the fall, right? These experiments. So that's all I have. I think I'm right on time, right?
You're
Gao?
right on time.
Thank you.